I'm so happy to be able to share tools that have immeasurably enhanced my service to clients since the 1970s.
And I am so excited to be Jim's co-presenter and very excited to be here with all of you today, introducing you to the amazing world of breathwork. In today's presentation, Jim and I are hoping to help you identify some of the advantages of faster than normal breathing techniques in trauma and addiction recovery by knowing the physiological and psychological effects of slow and fast breath modulation and taking away some of the tools to apply in your work with your clients.
So we'd like to start with doing some breath work before we even talk about it. I start all of my seminars and presentations with some use of the breath to help bring energies together, so to speak. People who breathe together are people who are more in sync energetically. So if you will, if you're willing to do this, I'm going to ask you to get yourself comfortably seated with your spine relatively straight and put your attention at the base of your spine. Now, as you inhale, bring the energy from the base of your spine up your back to the top of your head. And as you exhale, let that energy come down the front of your body, returning to the base of your spine. So continue inhaling up the back of your body and exhaling down the front. And imagine, if you will, ascending a light and a healing energy to every vertebrae as you go up the back to the top of your head. And then without pause, bring that energy, sending a light and healing energy to every vital organ of your body as you come back down to the base of your spine. Just do this a few times, letting it be an easy, natural, centering breath. This is something I do quite frequently with my clients to help them get centered. And what I tell them is that you have, with your breath and your intention, now created your safe place. As we know, in dealing with trauma, step number one is creating a safe place. And this is a very portable safe place that we can create anytime we want without anyone even knowing it. I then ask clients to breathe into the center of that circle of light that they've created, inhaling up the back and down the front, the heart space. And as you breathe into the heart space, have an intention for what you would like to take away from our work together today. Having a clear intention sets the wheels of manifestation in motion, as it were, and aligns you to coming away with what it is that you really want. Now, when I'm doing clinical work, very often I use inner child visualizations, especially in dealing with trauma and creating a safe place. And it's in that center of the circle that I invite people to bring in their little one, their inner child. And they're able to listen to that child, what they're feeling, what they need and want, with a greater sense of safety than just doing a visualization out of the blue, as it were. Okay, then with a few deep and clearing breaths, bring yourself back relaxed and refreshed. All right. First of all, Teri's going to tell you a little bit about what we're looking to do, our overall intention for today's seminar.
So I'm just going to revisit this again. We're going to look at identifying 3 advantages and 1 caution of faster than normal breathing, interventions that go along with that for trauma and addiction recovery. We are also going to be able to help you to name 2 physiological and 2 psychological effects of slow and fast breathing modulation, and to be able to be conversant with 3 breathwork tools for use during and after your counseling sessions.
Great. Thanks, Teri. Here is a formal definition of breathwork, which hopefully gives a little information. Breathwork is the science and art of breath awareness and breath modulation. It's directed towards releasing dysfunctional patterns of physical, emotional, and mental functioning and bringing a greater harmonious integration of one's network of life systems from the neurological to the spiritual, literally to feel more comfortable in one's skin. Therapeutic breathwork brings together time-honored healing traditions with contemporary breakthroughs in mind-body therapies. Therapeutic breathwork does not ask anyone to learn a whole new system and let go of what you already have. Therapeutic breathwork is a toolkit of different breathing techniques that can be used to supplement and enhance whatever you're currently doing as a therapist. I just did a breathwork training the last 4 days with clinicians from all over the country, and as a matter of fact, one from Amman, Jordan. And I'm getting emails here of how they've gone back to and done what they often do in their practice and found it much more energized, and their clients are working much more deeply, I believe, for 2 reasons. Not just because of the techniques that they brought with them to add to what they were already doing, but how they feel energetically themselves when they do breath work, because breath work is a practice that cannot be passed on to others unless you're practicing it yourself. So the theory and research, the physiological correlates we are going to be presenting, along with how caregivers can begin effectively using some of these techniques immediately. For example, that circular breathing that I just showed you can be done safely at any time to help bring a client to a greater sense of ease and safety in their bodies. We're going to focus on applications with addiction recovery, anxiety, and depression also will be mentioned of how breathwork is used for that. So, trauma is the frozen, undischarged energy held in the body and mind. It's often associated with the feelings of defeat and helplessness. Though we all can experience the effects of trauma, it's less than 20% of the population that's predisposed to respond to severe stress in a highly traumatized manner. Dan Siegel, eminent researcher in the field of trauma recovery, suggests that based on the study of attachment disorders, that early chaotic or terrifying exposure to a major parenting figure may be a significant factor in this predisposition. Nonetheless, not everyone who is exposed to the same extreme circumstances will develop severe symptoms of trauma. Those who are more vulnerable to severe trauma will take longer to recover, especially if they've had little support in the recovery process. The causes of trauma can be divided into 2 main categories: events that are most frequently traumatic, jarring, and common, and then unexpected events that can be traumatic under certain circumstances. So the first category includes obvious causes of trauma, such as war, severe childhood abuse, experiencing or witnessing violence. The second category includes seemingly ordinary events that traumatize more often than you might expect. The following are some of the potentially traumatizing occurrences that may not be so obvious, like minor automobile accidents or invasive medical and dental procedures, particularly when performed on children who are restrained or anesthetized. And even adults who rationally know that they are helpful may experience certain procedures as an attack, not intellectually, but your body experiences it that way. Circumcision, falls, and other so-called minor injuries or natural disasters. The symptoms of trauma are typically hyperarousal, constriction, dissociation, denial, feelings of helplessness, immobility, or freezing. Other symptoms that tend to surface concurrently with or shortly after trauma, several of them can, however, show up later, is hypervigilance, intrusive imagery such as flashbacks, extreme sensitivity to light and sound, hyperactivity, restlessness. And the final group of symptoms includes those that generally take longer to develop. In most cases, they will have been preceded by some of the earlier symptoms. And I only mentioned a few of these because there's a lot of literature on these now. I'm just hitting some of the major ones here. work by Levine and Vanderkoe and Siegel give much more detail about the symptoms. But ones that can develop later on are excessive shyness, diminished emotional responses, inability to make commitments, chronic fatigue or low energy, and even immune system and certain endocrine problems, depression or the feelings of impending doom. The symptoms of trauma can be stable, that is, ever present, or unstable. They can come and go, or they may remain hidden for decades. They rarely occur individually, but in clusters. So healing involves relinking our emotions, sensations, and pictures with more resourceful outcomes than being frozen and self-talk that's continually negative, like, I'm not lovable. Now, again, just to underline, trauma is not an event in one's life. It's the nervous system's response, because two people can have the same event occur to them. One will have long-term trauma and another will not. So the trauma is really our nervous system's adaptation to life events. A little bit about the biological nature of trauma and therapeutic breathwork. Therapeutic breathwork precipitously engages the sympathetic nervous system through the limbic system to help reprogram what has been frozen in the fight or flight mechanism. As such, fears arise and are breathed through consciously and integrated. So in other words, we're not just initiating a slower than normal, calm breathing. We are actually asking the person to breathe a little bit faster. We get into the sympathetic nervous system, but teach them then how to self-regulate when their nervous system is activated. So energy thwarted by trauma and unavailable for more creative endeavors than being on continuous red alert or hypervigilant is thereby recovered. It does not anesthetize fears that might be appropriate for the person's well-being, like wearing a seatbelt, but it helps put the original fears in a workable context to be understood and the energy of the fear to be integrated into more conscious use. Pathways that have been cut off to the prefrontal cortex during the emergency reaction are now activated in resourceful ways. And clients make sense to themselves and can make productive choices based on present needs rather than operating in a trance state of past trauma. Responses to threat are primarily instinctive and biological, and secondarily psychological and cognitive. There are three main innate action plans: fight, flight, or freeze. The arousal cycle looks like this when a threat occurs, according to Stephen Porges's Polyvagal Theory. We go from operating in a relative state of harmony controlled by the higher order mammalian branch of the vagus nerve, which keeps the lungs, heart, and facial muscles in equipoise, to the arousal state. The muscles tense, and we are on the search for the source of the threat. We mobilize the body and mind, activating the sympathetic nervous system via the second branch of the vagus nerve, which produces adrenaline and cortisol. We either use fight or flight to discharge that energy, and if it is discharged, then the nervous system is no longer aroused and returns to the state of equilibrium. In other words, we go back to that myelinated parasympathetic branch of the vagus nerve, the social engagement system. However, if the threat is not handled or is overwhelming, we go to the freezing response, dissociation, via the first or the primitive parasympathetic branch of the vagus nerve. This is an immobility response with the nervous system still highly aroused. The integration cycle is incomplete and is not able to be completed in the immobilized state. It's been speculated that this was built into our evolutionary nervous system. When an animal, say under attack, could not escape or fight back, would play dead. In other words, they would just go immobile. That does two things. One, it saves reserves that would be uselessly dispensed because they can't escape or fight. And number two, sometimes in the wild or even in human life, if someone is not fighting back or struggling, the predator gives up and goes away. It's not interesting anymore to them.